You're in the right place. This is the Eatfluencer Podcast, and I'm your host, Dr. Maggie Landes. Together, we are going to unpack everything about eating and discover the what, when, and how that will let you lead your best life. This is not your doctor's conversation about nutrition. Today is when you can start to love eating again. Let food be food and you be you. Get ready to get eatfluenced. Hi there, everybody, and welcome back to the Eatfluencer Podcast. I'm your host, Maggie Landes, and I'm glad you're here with me today. This is going to be a little slightly different format than my usual podcast episodes. You know that I do some solo episodes, some interview episodes. Most of them are 30, 35 minutes long or so. This one's going to be just a titch shorter because, well, I say that now. Of course, when I'm done recording, it might be the same length. But I'm in Texas. If you all are not aware, we had a huge, this is the 100-year winter storm last week, like an apocalyptic winter storm, practically. It was, we had 9 or 10 days in a row where we did not get a single temperature above freezing. Many of the days were in single digits, and that probably to many of you is like, whatever, I'm in Canada, I'm in the north or whatever. But the problem here is our infrastructure is not built for that. Our homes are not built for that. Our pipes are not built for that. Our roads are not built for that. We don't have the equipment, the sort of protection that a place that gets those temperatures on a regular basis. So there was a major power crisis, and most of the state of Texas was out of power, like electricity power, for anywhere from 2 to 6 days. Mind you, during sub-zero freezing temperatures. And, many homes here only have electric heat and electric appliances. A lot of, including my home, does not have any gas access. So pipes get frozen, pipes get broken. We end up having no running water, and the water system in the city becomes so damaged that the schools have closed because there's so much damage in the schools and flooding. And I kid you not. I can't even describe what we were doing last week. I live in Texas, and we were, the inside of my home was in the mid 40s degrees inside the house. And we're melting snow to preserve drinking water that we can boil because every pipe was frozen except for, one bathroom faucet. Just whatever. I am lucky. Honestly, my house did not have any damage, and we are, had access to food. We were able to eventually leave and go stay at a very generous friend's house so that we could have running water and showers and electricity and things like that. So there are people that died during this storm, and I'm not making light of that. My situation was only a annoyance and inconvenience compared to that. But, where I'm going with all that is that I have been extremely busy and distracted the last couple of weeks dealing with all that and doing a deep dive sort of research and inviting guests for a podcast episode was not at the top of the list when I was trying to find safe drinking water for my family. So all that to say, I did want to make sure you got an episode this week. So we're going to do 2 things. The first thing is that I'm going to point you to 2 other recent guest episodes that I did on other podcasters' podcast. They were both outstanding interviews by excellent non-diet professionals that you will love. Honestly, you'll listen to it, and it's cool that I'm being interviewed by them and that we have this really fun conversation, but you're going to love their content anyways. And I would really highly recommend that you take a look at these. The first one was the Speaking of Hungry podcast, which is hosted by Alison Barkman, who's a registered dietitian in the New York area, practices in an exclusively non-diet approach. And her episode 54, which was aired on February 16th, is called Taking the Focus Off of Your Weight. And she interviewed me, and we talked for about 45 minutes about this false connection that we all have between weight and health, and how we have an extremely weight loss focused and weight stigmatizing healthcare system. I go through some practical tips of advice on how to self-advocate, for yourself when you're seeking medical care, how to approach, your point of access when you're concerned that weight may be an issue. Anyway, it was a great conversation. Alison is very smart, very articulate, and I would love for you to listen to that episode. Maybe some of you saw it. If you follow her on social media, you may have noticed that I was the guest because she did some cover art with my profile picture on there. But anyway, so Speaking of Hungry podcast with Alison Barkman, episode 54. All right, that's the first homework you have. The second homework this week is to listen to the Joyful Movement Show, which is another podcast hosted by Kim Hagle, who is in Canada. She's a personal trainer and registered holistic nutritionist, and I was featured on her episode number 17, which was aired February 21st. And the title of that episode is called Busting the BMI Myth. And the conversation that she and I had was similar to the BMI episode that I did on my own podcast, which was episode 16, but it was different, and it was not redundant to listen to both of them because, she asked me some very good questions about, what to do when, in her profession, people come to her in the pursuit of weight loss. And many times they have been directed there by healthcare providers. And so how can we as a team sort of approach weight and BMI and how not to sort of exploit them in the name of health, and what can we really be measuring to really make people healthier? And I likewise on that episode talk about some practical strategies for discussing these issues with your doctor and to advocate for yourself when you're in the healthcare system, etc. So I think you will really like that podcast also. So I didn't do a really long extended podcast this week on my show, but I don't feel too bad because number one, I know that you are gracious, graceful people and allow me to survive yet another, what they call once in a lifetime history setting event. I'm sort of over it, frankly. But also because I have these two other very recent episodes on other podcasts that are great conversations. So you'll sort of get two for the price of one, and I'm happy to point you in their direction. The other thing I wanted to talk about this week, just briefly, is that this is National Eating Disorder Awareness Week. And I am not an eating disorder physician. I want to make that clear. I do not treat eating disorder patients at this time. That requires the care of a multidisciplinary team that involves dietitians, physicians, mental health providers, people that are specially trained in the care of eating disorders. But I have taken care of eating disorder patients during my training when I was in pediatric residency in Denver, actually. There was, this was 20 years ago almost, a very robust eating disorder program there, an inpatient eating disorder program that was run by the adolescent medicine team. And I got to take care of some extremely sick people that had severe eating disorders. And I learned a lot about that. And since then have not pursued a specialty in that. But now that I'm back in the nutrition space, I think it's really important that anybody talking about eating, talking about nutrition, talking about, the sort of weight-centered healthcare system, the fat phobia, this social weight stigmatization, I think it's important that we know enough about eating disorder symptoms, about risk factors, about warning signs, and advocate for getting care for those patients. It's one of those things where if you don't know what to look for, you'll never see it. I mean, that's just really the honest truth, is that if you're not sure how to find it, you won't. So I want to just go through some very, basic, but unfortunately very significant and concerning information and some statistics about eating disorder prevalence that hopefully you'll find interesting, and hopefully you'll be able to tuck away in your brain so that when you interact with if you're a healthcare provider, either with your patients or you're a some other sort of clinical nutritionist, dietitian, mental health professional, and you have clients or even just people in your own life, you recognize the significance of eating disorders and the need for getting those people to the proper care to basically save their lives. So I want to real quick go through the names and just a very, very brief description of what different eating disorders are. And I want to first say that the thing that people are very surprised by is that eating disorders are a psychiatric condition. It is a medical diagnosis. Okay, this is not a habit or a food preference or something like that. This is an actual clinical diagnosis. There are specific criteria to meet to be diagnosed with these disorders. And I'm not going to go into the weeds with that today, but it can happen to anyone. Eating disorders occur in anyone, regardless of their age, their sex, their ethnicity, their cultural background, their other comorbid medical problems, their social status. It's all comers. And that's important to know because the kind of belief system, particularly unfortunately in healthcare, is that people with eating disorders are young, white females in very thin, emaciated bodies. And that's what we picture when you picture a person with an eating disorder. But that is certainly only one kind of portrait of an eating disorder patient. And it is probably not even the most common portrait of an eating disorder patient. So we have a responsibility to screen people, kind of ad libitum and make sure that we're not missing this. The early recognition and treatment of patients with eating disorders, sort of the psychotherapy, counseling coupled with their medical care and nutritional recovery really, really enhances the chance of them leading healthy, full lives. Because unfortunately, eating disorders are the highest mortality risk psychiatric condition. Meaning that more people die from eating disorders than die as a result of having, schizophrenia or I don't know. I'm not even going to name all the psychiatric conditions. Whatever. But the point is that this isn't just like a little sideshow. This is really important. And like I said, if you don't know what you're looking for, you're not going to ever find it. So we're going to go through real quick here. Some of the things that you should know, that I think everybody should know, frankly, so that we can identify people that need help. So the two, ones that everybody has, if you know anything about eating disorders, you've usually heard of anorexia and bulimia. And, anorexia is primarily characterized by a state of self-starvation, where you have a intense fear of weight gain, an obsession with size, many sort of body dysmorphic issues with a disturbance in self-image, meaning the patient doesn't see the body the way that it actually is. Usually there's very significant restriction of food intake and that sort of thing. But it's not always as obvious. Like I said, it's not always as obvious as, the sort of image of Karen Carpenter or somebody that's just had a dramatic sort of cachectic appearance. But it's worth knowing that can happen. And there's, males that have anorexia. We're going to get into the statistics in a minute. I guess I'll wait for a minute and go into all that. But, anorexia is one. Bulimia is usually a cycle of binge eating followed by compensatory behaviors to counteract the binge eating. That can be vomiting, purging, laxative abuse, extended periods of fasting after binging, sort of compulsive over-exercising. It's basically this lack of control of taking in large amounts of food, followed by this sense that they need to over control the, sort of compensation for that. And it's very much out of proportion to, sort of a normal cycle of eating and, fitness, that kind of thing. Those patients with bulimia also have lots of concerns with their body weight, fear of weight gain and their body shape and size and things like that. So those are the two that people have usually heard of and are not completely unfamiliar with. There's another condition called Orthorexia Nervosa, and that is new-ish to the lineup in terms of being identified as a specific category of eating disorder. It's not new, like people just started having it. It's just a matter of us recognizing it in its own characteristics. But orthorexia, this is where it gets kind of tricky. Okay, I'm just going to read this brochure thing I have here just to make sure that I'm saying this correctly, because when I read this, you're going to think in your head, that sounds a lot like dieting. Well, and the answer is yes, it does sound a lot like dieting, which is why me and people that work in this space with me have such a concern with people pursuing diets all the time, because it is a very slippery slope from, dieting to disordered eating to an eating disorder. And orthorexia is sometimes that first kind of dip into the real, sort of psychiatric domain. But here's some warning signs and symptoms of orthorexia, and I'm just going to read this from the National Eating Disorder Association. Compulsive checking of ingredient lists and nutrition labels, a significant increase in the level of concern about health of all components and ingredients in foods, inability to eat anything but a very restricted, narrow group of foods that the patient deems, quote, healthy or pure, an unusual high level of interest in other people's food consumption, cutting out a significant number of foods or food groups, spending hours per day thinking about food, what might be served, how they would have to interact with food at social events, showing a high level of distress when they don't have ready access to the, quote, safe and healthy foods that they've predetermined, obsessive following of food, health, fitness, body image, blogs and, social media accounts. Body image concerns may or may not be present, but there is usually sort of a perseveration on size and weight. Well, that's interesting, because that certainly sounds to me like dieting. And here's the interesting part is, the diet culture is promoting many of these activities and saying that that's in the name of health, when really they are essentially, diagnostic criteria of a psychiatric eating disorder condition. That just blows my mind that, this is well documented that we would be advocating for these things that in a patient really should be red flag, flashing light warning signs, but then we're telling them to do them. Do you see the problem here? This is really, really, really big concern. Okay, so that's one that I'm really, really concerned about, because I think that we are almost advocating for developing it. You don't make somebody have an eating disorder, but eating disorders is a complicated, a complex sort of network or web of risk factors and characteristics that put a patient at risk. It's a range of biological, social, cultural ideas, psychological risk. It's, kind of different in different people, but certainly the medical community's pressure, especially on people in large bodies, to pursue weight loss by means of doing these things, cutting out entire food groups, perseverating on food decisions, always, beating them down about not having safe and healthy, I'm doing air quote, foods at all times. This following the people who are advocating for all the diets, like basically advocating for the diets is one of the risk factors. I mean, the whole thing is so screwed up. It's just really sad. But that's important to know. So binge eating disorder is another one. You'll see it abbreviated BED. And this is recurrent binge eating, which is eating a large amount of food, larger than normal, in a short time frame, and feeling out of control during the binge eating and distressed, around eating during that time. Usually it's in isolation. Usually there's some shame and guilt. There may or may not be compensatory measures. That's sort of where there's a little bit of crossover between bulimia and binge eating disorder, but it doesn't, it's not something that's always obvious, because there's a lot of, like I said, shame tied into this, and people are doing this in isolation, and it may not be as easily detected, even just in family members, because they may behave sort of, quote, normal around food when other people are with them. So this is a tricky one too. There's also several other unspecified or sort of NOS eating disorders, purging disorder, nighttime eating disorder. There's an atypical anorexia nervosa. I'm not going to go into we don't need to talk about all the details of this. There's also something called avoidant restrictive food intake disorder, or ARFID. And this is usually when people have significant limitations that they've self-imposed in the amount or types of food that they consume, but they don't necessarily have the distress about body shape, the fear of weight, all that kind of stuff. But it's sort of like a chronic under-eating with, so a inappropriate intake of energy needs and on an ongoing basis. So that's another one. It's tricky, super tricky. And just some statistics that are worth knowing. I already mentioned this can happen to anybody, but here's some things that are going to concern you. And these are all based on research studies here. I'm not going to cite the people, out loud here, because that's not very interesting to listen to. But trust me, this is all on the website from the National Eating Disorders Association, which is nationaleatingdisorders.org, if you want to take a look at this yourself. There are some studies that show that somewhere between 40 and 60% of elementary school girls, elementary school, so 6 to probably 11 or 12 years of age, half of them are concerned about weight, about their body size, or worried about becoming fat. Okay, that is a problem. Let's see, where is it? There's a huge problem with children whose mothers are overly concerned about weight. And, I've talked about this before on my podcast, that there's sort of these gradations of what your children are seeing. I mean, fat shaming verbally your children is the most obvious exposed, sort of bad thing to do. But there are women, I say women, it could be a father, but it usually tends to be the mothers, who do the self-talk and their disordered eating behavior in front of their children, and they don't even have to say a word. Their actions sort of speak for themselves, and those children develop unhealthy attitudes and behaviors about food, about weight, about body image as early as 3, 4, 5 years old. And I have just met so many people who are adults now, and they remember thinking that there was something wrong with their body when they were that young because of the way their mom talked to themselves, how the mom talked about their own body, or the actions that the mom had around food, or, not wearing a swimsuit, not wanting to be in pictures, not, whatever the situation was. The kids are very impressionable. And that is one of the things that sort of sets them up. It's, like I said, it's not, causative, but it is certainly one of the compounding factors in the development of disordered eating and eating disorders. So that's something to remember if you're a parent, specifically if you're a mother. Anorexia, they did some studies on adolescents and followed them for, 8 years, about 500 girls, followed them from 8 years, from the age of 12 to 20. And within that time, almost 6% of the girls met the DSM-5 criteria for either anorexia, bulimia, or binge eating disorder. And when they included non-specified eating disorder, it went up to 13% of the girls. So basically 1 in 8, a little less than 1 in 8, 1 in 7.5 girls. That's a lot. That's a lot of teenagers. The, belief is that I don't say belief, it's the evidence, is that, somewhere between 1 and 2% of all females will have anorexia at some point in their life. And about, roughly maybe a tenth of that will happen in males. So it's not as common, of course, in males, but it does happen. And when we're multiplying those percentages against the, population, that's a lot of people still. Males, can be maybe 20, 25% of anorexia patients, but they have a higher mortality risk than the females with anorexia. And part of that is because they are often misdiagnosed or diagnosed late, because there is a false belief that men don't have eating disorders, particularly binge eating, laxative abuse, fasting, purging. Those are almost as common in males as they are in females. So that's a concerning situation. Another thing that's worth pointing out that I think is just really important to know is about athletes. If you work with athletes, if you are the parent of an athlete, if you're in the fitness profession, this is something to be very, very attuned to, especially if you work with athletes, both male or female, that compete in sports that emphasize physique or weight, things like wrestling, horse racing, bodybuilding, gymnastics, figure skating, swimming, diving. That is a very big concern, and some of the research has shown that up to 2/3 of athletes participating in those types of sports may have disordered eating, and maybe even 10 to 20% may have actual eating disorders. So that's a concern. There's of course, a higher rate of injury in athletes with eating disorders because their metabolism is not normal, their bone density is not normal, the whole thing is just, there's a lot of side effects of these eating disorders. Probably another thing that may not be something you are familiar with is the female athlete triad, which is the combination of disordered eating, menstrual dysfunction or amenorrhea, and low bone mineral density. And some studies in college level athletes showed that, a quarter of, sort of Division I and II college athletes, females, had disordered eating and menstrual dysfunction. About 10% had low bone mineral density, and almost 3% had all three, sort of met the triad. So 3%. So that's like 1 out of, 33 female college female athletes. I don't know how to say that right. Had this very significant clinical diagnosis. And here's the interesting part that goes with that. When they did a survey of athletic trainers that work with female collegiate athletes, only about a quarter of them felt confident being able to identify an athlete with an eating disorder or could name any of the risk factors or criteria of the eating disorders. However, over 90% of the athletic trainers felt like they were or definitely had worked with athletes with eating disorders. So almost all of them have worked with people that they either know have eating disorders or they believe probably did have eating disorders, but only a quarter of the trainers can identify them. And about a quarter of the institutions surveyed had policies on screening for and managing eating disorders in athletes. The other 75% of the schools did not. So it's just sort of like up to, blowing in the wind, like whoever's going to figure this out. So this is really, really serious. And I don't want to go through this on and on and on and on, but, the point is this is occurring. This is occurring in all age groups, all social classes, all genders, all people. They don't have to be in a small body, and particularly people in, sort of, quote, normal or large bodies are rarely, if ever, asked about eating disorder risk factors. I know that I have, for one, never in a doctor's visit anywhere at any age in my life been asked about any questions that would screen for eating disorders. I mean, honestly, I'm never even hardly asked about eating at all, but it's certainly not in the context of, what I'm doing, my behavior with food, my amount of exercise, whether or not I'm engaging in purging or laxative abuse or using, diet drugs or, nothing. Like, no one has ever asked me that. They've asked about whether I'm going to fall or whether I feel safe at home, whether my, husband is beating me, but nobody has ever asked something that is, frankly, probably even more common. And that's really a disservice to our patients, because if we can find people that need help and we can connect them with the help, they can have very good outcomes, honestly. But if they don't get identified, their quality of life and potentially even their life itself is really at risk. So I think this is the obligation of everybody to know something about eating disorders, particularly if you work with people that might be considered higher risk. If you are a doctor, a personal trainer, an athletic trainer, you work with youth, you work with children or adolescents, you're a mental health provider. It is a fragile topic, and it's uncomfortable to bring it up sometimes because, once you ask, you have to be prepared to do something with the answer. If the patient or client, really does sort of screen positive for these concerning disorders, but we have to do it. It's really just our obligation. So if you don't have this problem yourself, you don't feel like you identify with one of these, and you don't know somebody who does, you probably don't know somebody who does. Like, the chance of you interacting in your life, whether it's in the workplace or your friend circle or, in your extended family or something, the chance of you knowing somebody who is struggling with an eating disorder is very likely. And I want you to know, if you're listening to this and you are either thinking, wow, I think I do know somebody, or even if you yourself are identifying with some of these descriptions that I'm giving, the sooner you seek help will protect your long-term physical and mental health, and the sooner you can be relieved of this burden. It's a disease. These are diseases. This is not your fault. You're not any more guilty of having this than somebody who's got, asthma or a gallstone or whatever other thing you want to say. It's not something that you caused. You will probably not be able to address it by yourself. You're going to need professional help with people that are trained in this condition and the treatment for these conditions. You deserve to be heard, and you deserve to have this taken care of. I will put in the notes for this episode at the bottom of the podcast download how you can get in touch with the National Eating Disorder Association hotline. They have a phone number, they have a text that is manned 24 hours a day, and they can put you in touch with more local resources to get you or the people that you care about care for eating disorders. So that ended up being a little more than I probably planned on doing, but I feel like this is important, and I'm glad that we were able to participate by just bringing a little bit of awareness during National Eating Disorder Awareness Week. So I also want to wrap up this episode by telling you that I am right now this week until Friday enrolling for my group coaching program, which starts March 1st, next week. So jump over to my website, maggielandesmd.com. All the information is there. And you can sign up right now and be part of this next group that starts on Monday. There are several choices of levels of interaction with me. There are several price points. So there is there's something for everybody. And I hope that you will consider joining me for that. All right. Thank you for tuning in, and we will talk soon. Thank you so much for being here today. If you love what you've learned, follow me on social media at Maggie Landes MD, and you'll never miss a thing. You can also check out my website at maggielandesmd.com and sign up to be part of our community of eaters. Thanks again for stopping by. We'll talk again soon.